So we talked about it this week. The Quebec government announced that vaccinations will be mandatory in the healthcare network. So in theory, and we heard your calls and your reactions, I mean, pretty much everyone across the board on the political spectrum is for this, but there are some risks involved in this measure. So what are those risks? Let's speak to someone who works in healthcare every day. Welcome, Dr. François Marquis, who is the Chief of Critical Care Medicine at Maisonneuve-Rosemont Hospital. Dr. Marquis, thank you so much for joining us today.
Yeah, thanks for having me.
So before I get into the vaccination, I guess you're pretty happy with the $94.2 million that was announced to greenlight the modernization of Maisonneuve-Rosemont, right?
Yeah, that's great news. And that was the most important step to actually start building the hospital, so you can be sure that everyone here will work as much as possible to make it happen as soon as possible for everyone.
That's great. I know the great work Maisonneuve-Rosemont does. When I was chairman CEO of the Olympic Park, and I was an M&A on the east side of Montreal. You guys do fantastic work. What is this money going to go to? Where is the investment going to go?
Well, actually, that's the most impressive thing. It's going to be for the hospital, and pretty much only for the hospital, because we already have the site, so we don't have to buy more land. Mainly it's just going to be to build the hospital. So it's a real $2.5 million. On top of that, obviously, we'll need some money to survive until we get the new hospital. But from what I understand, the $2.5 billion are only there for the hospital.
That's fantastic. So getting back to mandatory vaccinations for the healthcare sector, first of all, your thoughts on that decision. How do you think this decision will be received at the hospital?
So, well, I've said it before. My very personal opinion on that is that it is a great thing. Now, there's very little people that actually can't be vaccinated. They do exist. There's not a lot of them. So we do have to think about a way around for those people. But as I said, there's very little of them. So I think it's quite important, because the last thing you want is giving COVID inside the hospital to one of your patients that is here for something else. And at the same time, we really want to provide a secure and work environment for everyone, including those people that can't be vaccinated. So by making sure that everyone around them are vaccinated, you're actually shielding them. But they're not the only ones. This is, in my opinion, just the starting point, because right now the Delta variant is quite active everywhere where there's a lot of social things going on. So, people working in the tourism industry, in bars, in restaurants, they should all be vaccinated too.
So you think this should go beyond just healthcare workers? You're of the mind that we should be implementing mandatory vaccination with every person that has interaction with the public.
Yeah, well, that's my personal opinion.
Yeah. No, I understand.
It I'm not the.
I know you're not the government. I know.
But my opinion is, yes, obviously, if you're working in any kind of public area with the public, you should be vaccinated.
But you
and
are
for your own health too. It's not just protecting people; it's protecting yourself.
No, I understand. You are Chief of Critical Care Medicine at Maisonneuve-Rosemont Hospital, Dr. Marquis. So I think your opinion counts. It's good to hear. So, are there any risks involved? I mean, I'm hearing that some people, we've heard unions being weary of this measure. There could be risk involved. Do you see any risks in implementing mandatory vaccinations, either in the healthcare system or other systems?
So vaccines are like any kind of medication. You have indication, contraindication, and complications. And because they're working, actually, things can happen. Now, the first thing is that you have to identify people that cannot receive the vaccine for good reasons. And this we're quite good at. Now, from there are risks are very unlikely, but there are some little ones. But like for anything, if you compare the risk to the protection the vaccine is providing, it's strongly in favor of vaccination. Now, a lot of people get vaccinated for very different reasons. I'm not talking about COVID. I'm talking about vaccination at large. And we know it is like very safe. Of course, a few people could develop complications, but there's been so many doses already administered so far that pretty much all the complications, and we have like very good numbers, proving the security of the vaccination. Now, you will find a few people that will have side effects, mainly like small, pain on the injection site, and in my opinion, that doesn't count. Maybe you won't feel well for a day or two. In my opinion, that doesn't count because it's not really serious. What you're talking about is like severe allergic reaction to vaccines, Guillain-Barré syndromes. They are incredibly rare. And everyone is pointing those side effects, but they are so rare. Obviously, it's not an happy thing when it happens to you because, you don't have 1% Guillain-Barré syndrome. You have the syndrome or you doesn't. But if you look and compare, what you're protected from, you're doing a lot of things that are really more risky on your day-to-day life, like driving a car.
Dr. Marquis, thank you so much for joining us this morning. That's all the time we have today.
Okay, thank you.
Take care. Bonne fête de semaine. Dr. François Marquis is the Chief of Critical Care Medicine at Maisonneuve-Rosemont Hospital.